Good afternoon, and welcome to NBCDI's last Thursday's Virtual Learning Center series, where we will discuss the impacts of COVID-19 on the Black community and the vaccine. NBCDI will host these discussions on various topics with experts and leaders from around the country on a monthly basis, and we're excited for you to join us. Please share the information and host a watch party on Facebook. Let me introduce our speakers for this afternoon's conversation. First, my name is Debbie Hillman, and I am the historian on NBCDI Atlanta Affiliates Board of Directors. Kabir Kumar is the Senior Director of Community for Walmart, who's been a longtime supporter of NBCDI and the title sponsor for this event. Dr. Leisha Alice Cox is a double board certified child, adolescent, and adult psychiatrist, wife, mother, author, and wellness strategist. Reverend Sean James is the founder and senior pastor of Salt and Light, an interdenominational, intergenerational congregation worshiping and working in Southwest Philadelphia, and Mr. Airy in Mount Airy, North Carolina. In addition to being a pastor, he also has a vision for social justice, activism, and will share about that during our conversation this afternoon. Dr. Helene D. Gale has been president and CEO of the Chicago Community Trust, one of the nation's oldest and largest community foundations since October 2017. Under her leadership, the trust has adopted a new strategic focus on closing the racial wealth, ethnic gap in the Chicago region. And last but certainly not least, we have Dr. Kathy Anderson, MD, double board certified in general pediatrics and integrative medicine, president of North Dakota American Academy of Pediatrics, regional champion for equity, diversity, and inclusion for AAP, clinical assistant professor of pediatrics at University of North Dakota, and founder and CEO of Nurturing Wellness Pediatrics. As I said, we have an esteemed group of panelists who are working throughout the country. At this time, I would ask Kabir if he would please prepare to share some information with us. Kabir?
Sure. Thank you, Debbie, and thank you, everyone. It's a privilege and an honor to be here. When I look at the panel of my esteemed colleagues, I hesitate to say colleagues because this is the type of panel I would love to attend, and you've honored me by asking me to give opening remarks. So I'm sure I'm the least qualified person up here, but I appreciate this opportunity and appreciate the work that you all do on a day-to-day basis. So thank you. I wanted to talk about two things today, and I hope that that'll be helpful. And I know we'll get into further conversation after. First, I wanted to talk a little bit about Walmart's approach to giving and philanthropy, and then talk about that in the context of COVID-19 and vaccines. Prior to joining Walmart, I spent 15 years in the nonprofit sector, working at a variety of institutions in different countries, but also community foundations, other institutions that are doing good work in communities, with this fundamental belief that if you are local in a community, if you're proximate in a community, you should be better informed to make decisions about that community. And I was very fortunate to have this opportunity to join Walmart and lead our community giving. Walmart has a rich history of community engagement and philanthropy, but it's evolved over time. Starting in 1981 with $10,000, Walmart and the Walmart Foundation's giving has grown to $1.5 billion a year, of which $300 million is cash, and the balance is in-kind contributions, most of that being food, in partnership with Feeding America and food banks around the country. What struck me when I joined Walmart and looking at it was one, I had no sense that that's how much Walmart contributes back to communities. And what I started to understand was that community giving came from within the communities where we're fortunate to serve and employ associates and really become a part of that community. And something like our food donation program, in that program, we take a shared value approach. And what that means is we are looking to leverage core strengths of our business to do good and extend that through philanthropy. The idea for our food donation program was out of stores, came from a store manager who functionally saw perfectly good food going to waste. If you're like me, you probably, when you used to go to the store, if you go to the store, push the bread to the side and reach in the back, or push the milk to the side and reach in the back and grab that later expiry date. Well, the bread in the front, although it's perfectly good, the milk in the front, perfectly good, would end up going in a trash can. And some store managers said, hey, what if we could find a way to get that to a family in need and do it quickly? It's perfectly good food, and prevent it from going into the waste stream and rather go to someone who it can benefit. In that first year, the program went from 6 million pounds of donated food. And last year was over 600 million pounds of food, partnering with Feeding America, food banks, and food pantries around the country. But it wasn't just about giving food. It was truly a shared value approach of leveraging Walmart's expertise, the right product, the right place, and the right time to do good. So we could leverage our supply chain, our transportation, our expertise, our purchasing ability, and partnered with Feeding America to help them build their capacity, but also for us to help build the capacity of the sector. And it's a program that's extended well beyond Walmart and is helping throughout the country. So that shared value approach, how can we take core strengths of our business and leverage those strengths, pull on different levers and extend that into the community, is applied to all of our programs, including disaster response, which is one of the areas that I oversee. And probably like most of you, when COVID started, we had been tracking it in China, December and January. I thought, okay, March, April, I'm sure people will wear masks. We'll all get back to normal, no problem. It was May, June, then it was June, July. I didn't see an end in sight. And we started, like all of you, to see, in our communities, with our associates, with our customers, what was happening. And it was not affecting everybody in the same way. Different communities were being impacted differently. And we see this time and time again with disaster, because disaster does not create inequity, but it certainly reveals inequity. And we could see the breaks in our system, which have existed in every major event that we've had, but it was becoming more and more apparent. And the media started to take notice, and we had started to embed equity into our disaster approach about 3 years ago. So when it came to vaccine conversations, we already saw disproportionate impact on Black, African American, and other communities as compared to white communities. And we wanted to know why. As we started to make investments, and we'll talk about that a little bit later, we also started to ask ourselves, once the vaccine came out, is this pattern just going to repeat? And all the evidence, all the history, if we look at data, says yes, it's going to repeat. So we started to ask ourselves the question, a very important question. If in a best case scenario, we get to 80% of the country getting the vaccine in the next 6 months, and that's a really optimistic number. As I'm not qualified, but my medical colleagues will have a much better sense who are on this panel. Who's going to be in the 20%? And I think that question is what drove me and many of my colleagues at Walmart to say that sitting by simply isn't good enough. And what we also had to recognize is there are different reasons and different barriers in communities that are not going to lead to vaccine adoption. So what are those? Now, in a typical format, we would say, okay, well, let's survey everyone and we'll get to the middle of the data and then we'll apply and just try to do the biggest chunk. But if you solve for the middle, you don't solve for the fringes. And the most marginalized people in Black and brown communities are often on the fringes. So part of what we asked ourselves is, how do we work to identify barriers that are unique to communities and understand where there are commonalities and where there are differences? So we began talking to leaders of community-based organizations as best we could to be respectful of their time, as everyone's going through this all at the same time, but also understand what we could do to accelerate and support their work. And we found a few things which I'll share right now. One, trust obviously is a very important issue. The first level of trust was, is the vaccine safe? And this was across all racially diverse communities. We found this common thread. Is the vaccine safe? It seems like it was rushed. It was given a terrible name, Project Warp Speed, which nothing warp speed about it. But it certainly instilled in individuals this, I don't trust it. It was rushed. And so the first level is the vaccine safe? The second level we found in the communities we talked to was, if it is safe and I get it and I have a complication, am I going to get the medical care that I need? It's a very legitimate question. The third question was, if it is safe and if I get the help that I need, why should I trust a medical establishment that has either abused my community, taken advantage, tested, or not provided the same outcomes as other people with the same conditions? All very legitimate and very straightforward concerns, the concerns that I have. And then we started to try and understand in each community, what are those barriers? And we found that there is a barrier, or what is going to be the way forward? And once you understand the unique barriers in the community, it's different in the Black and African American community, it's different in the Native American community, different Hispanic and Latinx communities, very different in the Asian communities where a lot of times COVID data will get masked. You'll have communities that are very high and communities that are very low, and they average out to a number that's not so scary. But as we looked at those, we found that what we could do was support organizations working on adoption and access to vaccines with an understanding, because they are BIPOC led and BIPOC serving organizations, and they understand unique barriers in their community and have an ability to transcend that to help individuals with the information they need to make the right decisions for them and their families. And that was, what is the trusted message? Who is the trusted messenger? And what's the trusted channel? Is it my local pharmacist? Is it my faith leader? Is it my friends, my neighbors? And so for us, we found very fortunate to find a slate of incredible organizations that were looking to address this, and we wanted to build their capacity. So from organizations like NAACP, UNIDOS, Johns Hopkins Center for American Indian Health, OPCHO, which is an Asian Association of Health Clinics, as well as the Conference of National Black Churches, Interfaith Youth Corps. These were groups that were looking at specific communities or cut across communities where they have relationships, where they can help make a difference. And we started to partner with them to fund some of the great work that they're already doing and support work on this very important journey for all of us around reducing vaccine hesitancy, giving people the information they need to make the right decision for them and their families, but in a way that helps all of society. So thank you very much. I won't take up any more time. I look forward to the conversation ahead.
Thank you, Kabir, for sharing with us what Walmart is doing to impact communities of color. Let's get into the conversation with our panelists. Helping communities is necessary on many levels, from corporations to nonprofits, even to the faith-based community. Reverend James, could you share with us the role of faith leaders in public health and encouraging their congregation to stay informed on public health issues, and how can you, as a man of the cloth, as we say, make a difference?
Thank you, Ms. Hillman, for the question, and to the National Black Child Development Institute, thank you so much for this invitation. This question and this moment coming in the same time and space, coinciding with Dr. Skip Gates' documentary earlier this week, last week, about the Black church, I think is a critical Kairos moment, because still today, the Black church plays an instrumental role in our communities as far as developing the type of trust that Beer was talking about, and helping our constituents, our parishioners, increase both their knowledge, understanding, and their trust towards the health community. So first of all, I think it's really important right now for faith leaders to help to destroy the false dichotomy that often exists in our communities between spiritual healing and medicinal healing. And we often have this idea that if a healing takes place, that it cannot take place. It is not divine if there are doctors and medicines or hospitals that are involved. That thinking is neither biblical nor is it African. And a lot of what has happened in this moment right now, our individuals are getting sick who need not do so because their spiritual practice informs them that if they use medicines or they use doctors, that is not real divine healing, right? The prophet Jeremiah asked, is there a balm in Gilead? Balm is a healing ointment. And African spiritual practices have always believed in the use of ointments and salves and medicines, but that the divine was active in those medicines, right? So when Jesus spits on the ground and makes the clay that he puts on the blind man's eyes, tells him to wash in the pool, those are all medicines that are involved in divine healing. I think it's important right now for faith leaders, clergy people, for religious leaders to help those who trust us to understand that using medicine, using technology, using doctors does not eliminate the divine, but actually brings the divine into connection with the technology that God Himself has made possible for us. Secondly, I think it's important right now for faith leaders and congregations to not only encourage mediation methods towards preventing the spread of the vaccine, but it's really important for us, the spread of the virus, but it's important for us to encourage our parishioners to take the vaccine. And while there were many reasons, I think, early on when the vaccine first came out, historical reasons about the occupant of the White House, reasons about who was overseeing everything, I think that information is necessary and important. And it's really important right now that faith leaders are informing themselves so that we can combat disinformation and make sure that those who trust us are getting the right information about the vaccine. So first of all, the reason why we have eliminated so many diseases that were commonplace in earlier eras, including measles and mumps, polio, smallpox, are all because of vaccines. Vaccines work, first of all. Secondly, it's important for us to help our parishioners understand. I was recently at a meeting at the at Hospital University of Pennsylvania where I participated in their COVID-19 advisory committee. They were saying in December, there were 350 employees of their hospital who were sick or hospitalized with COVID-19 symptoms. That number today is 13, and that is only because of the vaccine. Because they have vaccinated 80% of the population, the vaccine is working. And as faith leaders, we need to know this and be informed about this so that we are not just another voice like the voices on social media that are extremely uninformed and are distributing information that is not helpful in this process. It's important that we let people know that the speed of the vaccine was not a speed in developing or testing the vaccine, right? But that pharmaceutical companies mass produced early on so that they would be ready. But it was a gamble on their part if they had not tested well. But they just wanted to make sure that we had the vaccine ready early enough. I think it's really important right now that clergy people are informed so that we can inform our congregation. And lastly, I would say that clergy people right now need to play a role in fighting for equity in distribution. And we're sitting at a time when it will be really easy for this vaccine to only find its way to the wealthy, to those who are well connected, to those who have power. And clergy people have a responsibility fighting for equity to make sure that the least and the lost and the marginalized also have access to a quality vaccine. And for Black and Brown communities, that's important, not just to make sure that the vaccine is accessible to Black and Brown people, but to make sure that even inside of our community, this is something that I've been fighting for recently in Philadelphia, that the vaccine is not just available for those who have agency, those who know the right people, those who have the right degrees, but rather that we make this vaccine available to those who have no agency, who are on the margins, who do not have the degrees or part of organizations that might make it available to some other people. If we are going to get control of this virus, then we must make sure that we equitably distribute the vaccine, especially in marginalized communities.
Thank you. So, based on the conversation that we're having this afternoon, we know that Walmart is making a difference, that places of worship are making a difference, but we're still hearing that people in our community are less likely to be vaccinated. Dr. Gail, can you start us off and tell us from your perspective how our communities are reacting to the vaccine and the likelihood of our neighbors getting involved and taking advantage of this opportunity?
Yeah, great. Thank you. And thanks to the previous two speakers for their comments. And, I'll start by just giving the lens and perspective by which I kind of approach this, and it's twofold. I mean, as you mentioned in my intro, I had a community foundation in Chicago, and we know Chicago has been hard hit by this pandemic, like many of our major urban areas. I also look at this from the lens of having co-chaired this study that the National Academies of Science, Engineer, and Medicine did this summer to develop a framework, the national framework for the equitable allocation of the vaccine. This was a study that was commissioned by the NIH and the CDC when we recognized that there would still be vaccines soon, but that there was a clear sense that there would be a scarcity in the beginning and that the demand would be higher than the supply. And that if we didn't think about how to equitably allocate this from the very beginning, it was very likely that those who had privilege and advantage would get the vaccine before those whose communities and families had been the most hard hit. And so we developed the framework that really looked at the different phases that we now talk about and use, that really looked at who was at greatest risk, so that we made sure that the people who were at greatest risk were the ones at the front of the line, if you will. And then we also put into that framework that communities geographically that had been the most hard hit and that were highest on what we call the social vulnerability scale would get geographic priority. You know, that was then given to CDC to further refine once there were actual vaccine candidates. And I just say that to say, you know, and then we had a series of different recommendations, of which several of them focused on this issue of vaccine hesitancy that we knew was such a big challenge. So I just say that to say, you know, from the very beginning, this issue of equity was embedded in the thinking of how should this roll out across the nation. And as was mentioned in the previous comments, clearly there has been, for a lot of different reasons, including where we were when the vaccine was first being developed and rolled out, this has developed a lot of concern, hesitancy, misinformation, lack of transparency that we're now having to deal with. And so, you know, if I switch from kind of thinking about, you know, what conceptually did we hope would happen at a nationally across the country, to where I sit in a local community, you know, I think we're seeing that all of the things that the previous two speakers mentioned is so critical to make sure that the vaccine gets to the communities where the harm has been greatest. And that if we think about the fact that those are the communities that have been most underserved in terms of access to services, and often have the most distrust of something that is created by the government, that, as was mentioned, you know, quote, created at warp speed, all of these things that I think really have meant that there has been this huge distrust in the beginning. What we're finding, though, is that with the right information and with the prioritization in communities where the need is greatest, and as people start seeing neighbors, people who look like them, family members, their clergy, the community-based organizations that they trust, as we see, as more people see people like them, people who they trust, getting this vaccine, we're seeing some of this hesitancy start to fade away. So, you know, while I think that we still have a big, a large job left in front of us to make sure that the vaccines are getting to the communities, that are getting to the places where people trust and get their services and their care, whether it's federally qualified health centers, whether it's pharmacies, whether it's mobile clinics, whether it's mass vaccination sites. You know, we need all of those types of places for people to have access, but then we need to continue to do the hard work of providing information that is relevant to people's needs, so that we start building that kind of understanding, trust, with the idea that if people are given the right information, they will make the choices that make the most sense for them and their families. So we're, you know, while I think we still have a ways to go, it is encouraging to see that the kinds of efforts that I think people are making are really starting to make a difference. And I think it was Kabir who said, the right messages, the right messengers, and the right access points. I think if we continue to push on those three things, we will be able to have this kind of equitable distribution that I think we all know is the right thing to do, the fair thing to do, but it's also the best thing in the interest of a public health response. We know that in anything that we do in public health, if we get to where the risk is greatest, that is when we're going to have the greatest impact. So it's not only the right and fair thing to do, it's also what is going to make the biggest difference if we get vaccines to the communities where the risks are greatest.
Thank you. So as we think about the community, one aspect of the community is served primarily by NBCDI. Those are families and children. And right now, the vaccines are only being given to individuals 16 and older. We work with children birth to 8. So what does the future look like for our children? Dr. Anderson, can you speak to this?
Absolutely. Thank you so much for inviting me to be part of this panel discussion. Oftentimes people will ask me, how does what you do in your daily life and work bring a new perspective to this discussion about COVID-19? And I can tell you that as a pediatrician, what I'm doing all day, every day at work is talking with children and families and kind of weighing risks and benefits so that we can make informed decisions. What we know about COVID is that it affects adults for the most part, as far as having severe disease. We're seeing some increased effects in children with that later inflammatory condition, MIS-C, but we're not seeing that in high numbers. We are seeing it in higher numbers in Black and Brown communities, however, so that's something to keep in mind. But one thing that we have to consider is that when we're practicing pediatrics, we're actually caring and advocating for children by caring and advocating for the whole family, because the health of children is intimately tied to the health of the adults in their lives. And when I'm talking about health, I'm talking about, that continuum that involves physical health and mental health. I can remember growing up with both my parents and my grandmother. And I remember her telling me about how she didn't go to the doctor because she didn't trust them. They weren't going to keep her healthy. And I mean, when I think about the communities that we live in and what our parents and grandparents have told us and why there's this sentiment of mistrust, there are clear reasons why. We know what's happened historically. We know the studies that have been done, and we have to consider that when we're weighing these decisions. So in our communities, what we need to consider is that the COVID-19 pandemic has differentially affected us. We know that risk factors like high blood pressure, diabetes, sickle cell disease, obesity and overweight are at higher rates in Black and Brown communities. And I won't talk specifically about why, because I think that's a whole nother panel discussion where we can talk about race and health in the United States. So that's one risk factor that puts us at higher rates of severe disease, a higher likelihood of severe disease. But we also work in jobs where we're more likely to be exposed. We're doing service jobs, we're in contact with more people. And then, lastly, if we do need to access the medical system, and there was a question, earlier that was suggested, like, if I do need to access the medical system, am I going to get the care I needed with regard to the vaccine? But I would turn that question around. If you need to access the medical system because you have a COVID-19 infection, what are the obstacles to that? And we know that in Black and Brown communities, there might be difficulties with access. We know that there have been several studies to show that the implicit biases of those providers providing care to people that look like us is going to be different. And since we know all of these things, I think we really need to continue to have these discussions with our family members, with our communities, with our friends at church, to let them know that really, given the risk that we all have for severe disease, the vaccine is something that we need to really strongly consider. So lastly, as far as, how does this relate to and what are we expecting with regard to COVID-19 in children? They're now doing studies down to age 12 with the COVID vaccine. And, the expectation, the projections are that hopefully by fall, we'll have it approved for children down to age 12. From there, it gets a little bit more complicated. To do studies for children under 12, we're going to first need to check the dosing that we're going to use for the vaccines, and that may differ in smaller and younger children. So there's an added layer of research that will need to be done before we roll that out in younger children. So for right now, I think it's important that we share the importance of the vaccine in the populations that are eligible, that we continue to educate ourselves and each other about what our risks are of getting the vaccine, but also really you can't weigh the risk of any vaccine if you're not weighing the risk of the actual disease. And what we do know to be true is that the risk of disease within our communities being devastating is much, much higher.
Thank you. So as we continue our reflections on the children, we know that the pandemic has impacted the social and emotional well-being of our children. Dr. Leisha, could you tell us a little bit about how our children have been impacted in this way and what parents and caregivers can do to buffer those effects?
Sure. I think my video is still disabled. Can someone disable my video? It's saying the host has it disabled. Okay, got it. Okay.
There you are.
Thank you. Thank you so much for the opportunity to participate on this panel. And as Dr. Anderson already mentioned, COVID has had a devastating impact on our community, and particularly Black and Brown families. And it's not just been a physical impact, because clearly we have seen higher rates of death and severe illness for Black and Brown people from COVID, but we've also had a significant impact mentally. And that impact has been felt by our children as well as parents. And so specifically for kids, we are seeing high rates of depression and anxiety. Part of that comes from one, just kids being worried about something happening to the people that they love. I'll say for us, I have 3 children and we ended up getting COVID in November, right before Thanksgiving. And my son, who's 10, was terrified that we might die, that his mom or dad would die, because he has heard horrible stories of people getting sick, loved ones getting sick, family members, friends of his from school getting sick and having loved ones die. So he was very, very afraid that something bad could happen to his mom and dad, including death. So kids are anxious about loved ones dying or being very sick. They are worried about their own health and well-being. They are depressed. We're seeing higher rates of depression because of isolation. So kids who are either in virtual school or even if they're doing hybrid learning, but school or even traditional school, but school is not what it used to be. So my kids are back in school full time, but they have to wear a mask. They are 6 feet apart. Recess isn't the same. The teacher can't stand close to the desk. They're not doing small group work. Their social activities are changed dramatically. They're not hanging out, playing with friends. Sports may be impacted, and that impacts their mental health because we know isolation is a big component of depression. So we're seeing increasing emergency room visits. We're seeing increasing outpatient visits for families who are requesting therapy services or even worrying about medication because symptoms are getting worse. There was even a school district in the Las Vegas area where there have been an uptick in the number of suicides in that community. So this pandemic is not without significant repercussions outside of the 500,000 deaths that we've seen in this country alone. So I think it's important, one, as Dr. Anderson referenced, to be effective as parents, we need to check our own mental health first. If we are struggling emotionally, and many of us are, even if it's not full-on depression, but I've been talking a lot about pandemic fatigue because you get burnt out. We have taken so many roles. I'm a mom. I was busy before, but when we were doing all remote, I had to be a teacher, and I'm not a good teacher. I'm a good mommy. I'm a good physician, but teaching is not my strength. But so you're being teacher and you're being chef and you're, being many people trying to be healthcare providers to determine if that cough, that sniff, or that fever or headache was COVID. So we've had to take on many, many roles, and it leaves us overwhelmed, stressed, burnt out, not sleeping. And so we have to check our own mental health first. And then I think the other things that we need to do for our children, one is to validate their concerns. It's not enough to just say, oh, everything's going to be fine, because it's not true. Now, that being said, we have to be careful not to overshare and say, oh, this is so bad, everybody's dying, because that's not true either. And it can create a lot more stress and concern for our children. So it's important to use developmentally appropriate language to say, hey, you know what? There are some scary things happening, and COVID is something that is important that we need to protect ourselves from, and then provide reassurance by saying, these are the things that our family is doing to keep us safe and keep the people we love safe. So we talk about why wearing a mask is so important. We talk about why we don't get to see our friends in person and why we need to be creative to do things like we've had Zoom bingo with extended family. We're in Alabama, but we have most of our family is in North Carolina. So we had Zoom bingo games. We've done indoor picnics when it's cold. We've had family movie night because we need to still have fun. We've been getting outside to get vitamin D and get some fresh air, and vitamin D is good for your mental health. So we talk about why we wear masks. We talk about why we wash hands. We talk about why we don't get to hang out with our friends. We talk about why vaccinations are important. My husband and I both have received one vaccine. And so that's really critical. So we reassure, and we talk about safety. And we also have honest, open conversations about how do we protect our mental health. So another thing that's important too is watch what you're saying in front of your children and watch what's on TV. There's a lot of stuff on TV. There's a lot of negative statistics that come out that even if it's in the background, but our kids are paying attention to, and they may find some of that information scary. And even the conversations that you think that you're having that are private, kids must have bionic ears or something because they hear everything they're not supposed to hear and none of the stuff that you want them to hear. But so we want to watch the language that we're using around our children because again, that can stir up fear. So that's an important piece as well. And then if they need help, then we need to get them help. We need to contact our primary care doctor and a referral for a therapist or a psychiatrist. If we need to get our own help to protect our mental health, and that's what we need to do as parents and caregivers. And lastly, I will just say, vaccinations are such a critical part of how we are going to stem the tide, not only of COVID, but of the mental health pandemic that has come on the heels of COVID-19. And so for me, as a lover of Hamilton, I'm not going to miss my shot. And I have taken every opportunity in, appointments with families, and even with my church, we had a panel There's an ongoing panel series about the importance of this vaccination, and trying to dispel myths and separate fact from fiction. So I take every opportunity to educate people that I treat and others in my community about how important this vaccine is, so we can get back to some semblance of normalcy for the safety and well-being emotionally, physically, and mentally for ourselves and our families, our children, and our communities.
Thank you. Thanks to all of the panelists who have responded in such an informative manner for all of our participants this afternoon. I'm going to ask that each of you turn on your cameras now, because the next set of questions that I will be posing to you are open to any of the speakers. NBCDI is committed to educating our families. And so we want to make sure that they know the truth. I think that you just said, Dr. Alicia, the difference between the things out there that are true. There are some other things that are not true. And we are hearing all of them sometimes in the same conversation. So as families of color, how can we share information with them that will keep them informed and help them figure out what they should consider in making decisions about the vaccine and other COVID-19 related topics? And that's open to everyone. Just jump right in.
I can answer or start with that response. The first thing I like to start with is, what do we know? So number one, we know that COVID is killing people, right? It's killing people dead. That is sure. And we know that Black and brown people are dying at as much as 3 times the rate of whites. So that is a known fact. We know that vaccines work. They are highly, highly effective. We know that the majority of people who received the Moderna or Pfizer vaccine, there are not deaths, and the severity of illness has been significantly reduced. We know that mRNA technology has been around. It is not new, as some might suppose, but it actually has been around, even though its use in vaccines is novel. So those are the things that we know. And we also know that we want to, I don't like to necessarily get back to full normalcy, but I say some semblance of normalcy, but we know that we miss our friends, we miss our families, that we're getting tired of wearing masks, even though masks have become delightfully, bedazzled and beautiful and fun, but that is not what we desire. And one of the surefire ways to do that effectively and to make sure that we don't get people we love sick is a vaccine. So that's where the place that I like to start. Now, you always have to talk to your doctor, but this is about facing the things that we know with a known, safe, and highly effective solution, and that's the vaccine.
Would anyone else like to chime in on how we help our community learn this and share it?
Yeah, I guess I would just add to what we know. The flip side of that is what we don't know. And I do think it's important that we're transparent about what we don't know, because, we are still new in this. And, we don't know, for instance, how long immunity lasts. Are we going to need a shot every year like we do with the flu vaccine? We don't know, whether or not some of the newer vaccines, for instance, there's a vaccine that is most likely to be authorized for emergency use over this, this weekend. We don't know whether, it's been tried as a 1-shot dose. They're also going to continue to look and see whether 2 shots actually boost the immunity even further. So, without getting to all the things we don't know, there are things that we still don't know, because there's nothing that can take the place of time. And, we will need to continue to look at our immune response and these vaccines We know that there are new variants that are coming out that so far, it looks like the current vaccines are effective against these, but we'll probably have new variants. And so I think we also have to recognize that there are things that we don't know because we've only been dealing with this pandemic now for just over a year. And I think in the interest of total transparency, we've got to both say the things that we do know, but also accept the fact that we're still learning, so that when there are things that might happen, people don't say, you told me that, certain truth, and, here we're finding out new things. But I do think starting with what we know, and again, I think, we've got to make sure that we use the right messengers to give these messages. One of the best things is that, one of the vaccines that was developed, the Moderna vaccine that NIH had a huge role in, one of the lead investigators is this wonderful young African-American woman. I think she has done more for demystifying this for people of color because she was there. She was in the room where it happened. And I think we can't, back on the Hamilton theme, I think we can't underestimate how important seeing people who look like us really is, as we go through what for people, as everyone has said, is a very scary time. This has been a really weird period in our history, and we have to acknowledge that and acknowledge the fear that people have going into this. So the more that we can also demystify, say what we know, what we don't know, and do it in a way that respects people's dignity, because I think, all of us are here because we believe in the vaccine. But the worst thing that we could do is to tell people, you must get this vaccine, when people may not be ready for it yet. And I think we also have to recognize that this is a journey. Some people start in a place of absolute mistrust, and we know why. We know why there is a history of mistrust. We've got to respect that and meet people where they are and go on that journey with them.
So one of the questions, Reverend James?
No, I was just going to say, get into all of that. Also, I think most of the misinformation about COVID-19 was spread on social media. And so I think that we need to use social media as a way to reverse that and to make sure that we're getting good, solid, factual information out there as often as possible. There was also a quick question that was in the question and answer about the equity of distribution. And I just want to say, in whatever community you're in, if you're finding that to be a problem, I think it's really important to inform the people who normally would fight in our communities about this. And I would, in my area, it's clergy, to be really clear that yes, undoubtedly in the Philadelphia area, it has been easier in the suburbs and in white communities to access the vaccine. Smart Black folk, honestly, in Philly are going to the suburbs to get the vaccine. However, where the vaccine has been readily available in Philadelphia has been from the Black Doctors Consortium, a group of African-American doctors who have been working really hard to test and vaccinate Philadelphia. And so if you live in an area where you're noticing that there is a great inequity in distribution, I think we need to sound that alarm, let everyone know that's happening, sound the alarm everywhere, including on social media, and make sure, especially in whoever is responsible. In our area, it's the Philadelphia Health Department, and it's been made very clear to the Philadelphia Health Department by many of the clergy and the social justice groups in Philadelphia that we expect a more equitable distribution. As of last week, in a city that's 45% African American, the vaccination rate is only 13% in the African American community. That's extremely problematic, and we are not just going to sit by and let that happen. We need to use every vehicle we have to encourage equity.
Thank you. One of the questions that came from one of our attendees was, if an adult in the household gets the vaccine, does that add an additional layer of protection for his or her children?
Well, I can take this one.
Okay.
There are a couple of add-ons I'd have to what we know. One is that you cannot catch COVID from the vaccine. This is not a live vaccine. And that has been a question that I've heard from many parents. You know, can I get it from getting the vaccine? So the answer to that is no. And the second is about 2 weeks after the second dose of the Pfizer and Moderna vaccine, both are showing that they protect people, that people carry immunity over 90%. So over 90% of those who 2 weeks after they receive the second vaccine carry immunity. And so with regard to if an adult gets the vaccine, does it protect their children? If the mother gets the vaccine and she is breastfeeding, she can pass some immunity on to that child. So that's one of the benefits of breastfeeding in general, right? You know, that we're passing on those immunoglobulins, those proteins that help us fight infection for any infection. So we believe that that is true. We also believe for that population that's breastfeeding that it's not a risk to get the vaccine, although they haven't been specifically studied yet. For other children within the home, I think it would depend on where the parent works. So if the parent is in a high risk work environment, like working in a hospital or in a service industry where they're seeing lots of people, then the parent carrying immunity protects the children to some extent from getting the infection that way as well.
Okay. Yes.
Can I just add something? You just to maybe a slight clarification for people, because I think people think of the vaccine as protecting from infection, when what we know it protects is disease. You know, the trials were done with the endpoint being moderate to severe disease. So we know that if if you're exposed to COVID and you've been vaccinated, it reduces the likelihood by 95% that you will get the disease. We don't know, although it's very plausible, we don't know that it actually protects against getting the infection. And so I think it's important to realize that, so that when you're in a household, if you've gotten the vaccine, you might still be able to get the infection, carry it in your nose or your throat, and you could potentially still pass that on to people in your household. Now, it is very likely, and there's more data coming out that suggests that it also it protects, does provide some protection against infection. But I think it's important for people to realize that what we do know for sure is that these vaccines protect us from, if we get the infection, from getting sick from it. And that's a distinction, particularly when we think about the households. And it's why we say, even after you've been vaccinated, it's important to still wear your mask. Until we're all vaccinated, until we really know that we got that herd immunity that people talk about, it's important that we still, even once vaccinated, remember that we should still be wearing masks, social distancing, washing your hands, etc., until we do know more about how it works to prevent infection and transmission.
Thank you. Our time is rapidly coming to the close of the hour, but there was just one last question that was posed in the chat about, and they asked from the perspective of the faith community. It goes to the issue of inequity. What are we doing to support those individuals who don't have access to the sign-up mechanism, for lack of a better word, just bringing it all the way home, who don't have a computer to use to sign up for the vaccination? What can be done, or what is being done for that part of our community?
So I say that's not just an issue for the faith community, but the community in general, that those who don't have the technology that allows them to access, sign up, register for the vaccine is an issue. I think that's something that has been missed. They are falling through the cracks. And what I've been advocating here in Philadelphia is more that are closer to home and that people can go to without registering. Churches are helpful in doing that because often churches will be an access point for people who don't have that technology. You know, most congregations now in Philadelphia, we're pretty much completely still virtual, including our public school. My kids are still in virtual school. And so what we know is we're missing people because of all of that. So we've had to do different things, telephone, cinema, CD. I mean, you know, who still has a CD player? You know, old people who still want to be on worship. And so you have to likewise develop a plan to make sure you catch those groups. My opinion, the larger distributions where people have to sign up are harder for those. The way you make it easier for those groups, if you say on Saturday, Sunday, this Sunday, come by the church. We are prioritizing that community. We are looking for people who were not able to access it another way and have vaccines available to them. There are a lot of things that are difficult in that, including refrigeration of the vaccine, and you know, once it's out of the freezer, that you know you have to make sure you use it and a certain amount of time and everything. However, that's a very good question. What I'm noticing is that those individuals are falling through the cracks, and I think that municipalities do need to develop a way to get to those who don't have the technology to register, who are probably the people who right now need the vaccine.
I will close our conversation by one, thanking our esteemed panelists for joining us this afternoon and sharing information that we know that our participants have found valuable. NBCDI offers resources and support for parents and families and children about this particular topic and many others. We know that we still face many challenges. We encourage you to follow us on NBCDI.org. We're on social media. There are affiliates in many of our communities. Please follow us. Please take an opportunity to join us. We have membership opportunities, and we encourage each of you to, as they say, stay woke, see what's going on. As our panelists have said, pay attention to the facts, help dispel the myths, and thank you for spending a part of this last Thursday of the month with us. Thank you.